Okay, I think let's start the session. Okay, hello everyone, and welcome to the HealthSync Beta launch. My name is Damien Ponvira, co-founder at HealthSync. Joining me today is my co-founder Ramidu Jayakodi, founding directors Felix Ponvira, Malshan Ranamella, along with the HealthSync team. On behalf of the entire HealthSync team, we are truly grateful to have you with us today. And as a Sri Lankan tech startup, today marks a very important milestone in our journey towards building a patient-centric digital health ecosystem in Sri Lanka. You are among the very first to experience HealthSync, so welcome. Let's talk about what to expect during this session. This is a 1-hour session. We will try our best to keep this session less boring for everybody. First, let's understand the vision behind HealthSync. Then Ramidu will give you a live demonstration of the HealthSync platform. And during the demonstration, he will highlight the core features of the platform. And after the demo, we will explain what we expect from you as a beta users. And we will walk you through the measures in place to protect your data. And there will be a Q&A session at the end, so you can ask any questions. Okay, let's start by discussing why HealthSync exists. Where do you keep your medical records today? If I ask you a question right now, whether do you have your mother's or father's blood reports from 6 months ago, what would your answer be? That's not a difficult question to answer, but it is for us in Sri Lanka. So this became very real to me when my father had a heart attack back in March 2025, exactly a year ago. As I'm living abroad, I felt so helpless. I didn't have any access to any of his medical records. I didn't have his all records or any reports. I didn't have his medication history with me. I didn't know his exact clinical background. In an emergency, information matters, and doctors are not magicians. They cannot treat what they cannot see. So let's say you get a blood test done today. Your health is not in that report. This report is just a snapshot, a single moment in time. Your health is the story. It's built over months and years. Without that story, without that history, the full story is missing. When information isn't available, care slows down. So this whole experience that I went through made something very clear to me, that this needs to change and Sri Lankans deserve more. What if everything, all the records in one place, if we had everything in one place, and exactly 1 year later, we have a solution. And what is HealthSync? In very simple terms, HealthSync is a place where you can keep all your medical records in one place. It could be prescription, doctor notes, appointment reminders, lab reports, everything in just one secure location. And when you have everything in one place, it's easy to organize, and you can share all your health records easily with your doctors and healthcare providers. You can manage health records for your entire family in one place. I'm very excited for my co-founder Ramidu to walk you through this platform where he will show you everything that you need to see. And with that, I would like to pass it over to Ramidu to walk you through the HealthSync platform.
Hello, everyone. Thanks for joining today. So I'm Ravinder Jayakodi, co-founder at HealthSync, and I will be doing the demonstration to walk you through the application today. And without further ado, let's straight away get into it. So for the ease of demonstration, I will be using an imaginary family, the Pereira family, where the father's name is Sarath Pereira and the mother is Nimali Pereira, and they have a daughter named Tarushi Pereira. So first, I will walk you through the sign up process, and we will sign up the mother Nimali Pereira into our portal. So there are two options to sign up. You can just navigate to this sign up link, and you will be displayed to add either the mobile number or the email as the verification. So I will enter the mobile number here, and then you will simply receive an OTP where you are prompted to add it here. Upon clicking the verify and continue, you will be prompted to this screen where you are to add your basic details here. And upon filling these basic details of yourself, you have to enter a secure password to keep all your details securely. And you can simply click this next button. So this is the consent to service screen where you are displayed the full introduction and purpose of this service. And this is specifically catered to the pre-release or the beta version. You can click this expand button to see this in a larger view, and you can navigate through this very easily. Please make sure that you read everything in this consent to service before agreeing. And you have to manually sign your signature here, and you can either send this to your email or get this as a printed document. If you forget to do either of those things, this document will already be available in your system once you log in. You can simply click the register button to move forward. And this is an optional step where you are asked to upload your identification or your NIC or passport. So you can simply click remind me later to move forward without uploading, or you can simply upload the documents here. So I will upload the NIC front and back images here and simply click the next button. And then you will be prompted into this welcome to HealthSync screen, where there are very basic introductions about our application, and you can navigate to our privacy policy or terms and conditions from here as well. I will get started, and this will navigate you to our dashboard. So your sign up process is now complete. And to continue the demonstration, I will move to the father's account, who is Sarath Pereira, that I have already signed up with. So I have logged into Sarath Pereira's account. As you can see, the account name is displayed here. And you can also see that there are several documents already added here. So I will walk you through the dashboard section first. So in the left side of the dashboard, you can see the most recently added or updated set of documents. And on the right side, you are prompted your care team. What does this care team mean? So these are basically the doctors that you have consulted with in the past. So if you take this Dr. Hittarage Aryasena, so then you will be able to view all the documents that you have consulted with this doctor in the past by clicking this view all documents button. So this is a pretty convenient view if you are continuing a consultation with a specific doctor for a longer period. So this will basically enable to view you all the past documents that you have gained from this doctor consultations. I will move back to the dashboard section, and there are quick add buttons for documents and family members in the dashboard as well. And As you have noticed, there is a section called AI Health Report Analyzer. So this feature is not yet available, but soon to be released. With this, you will be able to easily understand your lab reports without any confusion. So we will be releasing these type of new features every other week with our application. So as beta users, you will be the first set of people to test these things out. And I will now navigate to the health records section to demonstrate how to basically add and manage your health records. So as I mentioned, your consent agreement is already here, and there are some other reports that Sarath has entered in the past. So I will simply add a new document here. So upon clicking this add document, you are able to upload or drag and drop any sort of a document in here, and this supports up to 10 documents per upload. And please make sure to add a understandable document name here so you can refer to it later. And you have to select the document type here as well. So I will select lab and diagnostic reports, and that's it. You don't have to fill all these sections in order to upload a document. You just have to select these two only. So all the required fields are already filled here. And apart from those, you can either add the doctor name here, and we have synced all the active consulting doctors in Sri Lanka into our portal, and also the hospital or clinic name, and an expiry document to this date if there is any, and if there are any notes or comments. Also, we have a reminder date and time that can be set, and also a reference to this reminder. So once you have filled all these details, you can simply click this add button to add the document. And the recently added document will be displayed in the right side of the screen. And if you want to see this in the full screen view, you can click this expand button. And when you navigate to this details section, you will be able to see all the details that you have set for this. And it is pretty easy to update too. Once you do an update and click the Save Changes button, it will be updated in the database. So once you add these documents, you are able to navigate through them pretty easily using a scrolling option. And by default, only the most recent year's documents are expanded, but you can anyway expand any year that you want to view the documents in. And we have some pretty supportive and comprehensive set of filters too. So you can easily filter any document using the name here, and it will be displayed. Or you can navigate to this advanced filter section and search by the document name, doctor name, the year, and a date range, or a document type, or a document status, the hospital, and if you have marked them as favorite, and by that option as well. So this is our document section timeline view. So if you are not very accustomed to this view, we also have this list view option if you are a list view guy. So you can pretty easily navigate from this list view to view any of the documents as well. Upon clicking one item, the document will be open, and you have these quick action buttons here as well. So let's say you have this one document that you want to share with some doctor. So how do you do that? As you can see, you have these quick action buttons in the bottom right corner of the document section, where you can easily generate a QR or a link to share this. So for the demonstration, I will generate a link for this. You can add the reference here, and also an expiration time, and pretty easily generate a shareable link. So this link is secured with a password. So you have to copy this password at once because this will not be displayed again for security reasons. So you can just share this URL with your doctor or anyone you want to share this document with, and also the password. And upon entering the password and clicking verify and view document, you can pretty easily view the document. So we have the QR generation option here as well. Also, there are print and download buttons here as well. So this is everything for the document section. Now, if you are wondering, how can you manage the records of your family? Let's say in your family, there are some not very tech savvy people and small children that you want to manage their records. Or if you want to manage your loved one records by yourself, you can do it too. So if you navigate to this family section, you will be able to see your currently added family members here. So for a family member to be added into the portal, that specific family member has to have a separate HealthSync account. That means they have to be registered in the HealthSync portal with the sign-up processes that I have mentioned before. So for the demonstration, let's try to add Nimali Pereira, the mother, into this family as the spouse of Sarat Pereira. So you can pretty easily navigate to this add family member section and search by the name and click the user that you want to add as family. And as a security feature, we have added the date of birth here. So the requesting person has to enter the date of birth of that specific family member that you are trying to add. And you have to select the relationship. I will select spouse here, and you can easily send the request. So in this send request section, you can see that Nimali Pereira has been requested to add as the spouse of Sarat Pereira. So if I navigate to Nimali Pereira's account now and go to the family section, it will display you have one pending request from your family members. And if you click this review button, you will be able to view it and either accept or reject it. So I will approve this request and navigate back to Sarat Pereira's account. And if I navigate to the family section, Nimali Pereira is already added as a family member, as the spouse. So how can you manage these family members' health records? So it's pretty easy. Just like managing your own health records, just navigate to the health records section and you can see this drop down option here where the Sarat Pereira or my account is currently selected, and you can just click on it and select whatever the family member you want to manage the records in. So if you click Tarushi Pereira, it will display the records of Tarushi Pereira here pretty easily. So if you want to add a new record for Tarushi Pereira, you can go to add document and select the document and give this a document name. And in this visibility section, you can only select the family and care team option here because you are managing this health record on behalf of Tanushi Pereira. So you cannot add this only me option. So I will keep this for family now. And you can select the document type here and just add it. So this will be added to Tarushi Pereira's account. And if she logs into the HealthSync portal and view the timeline section, she will already be able to see this record herself. So this is as easy as managing your own health records to manage your family's or your loved one's health records. So that is the feature of managing your family section records. And these are the core two features that I wanted to give you an idea of how to navigate and use in our system. So we have this profile section and the settings section to manage your own settings and profiles data too. So I will not go through them because they are very much self-explanatory. So as I mentioned, we will be releasing new features every other week. So you will be able to test these out. So let me say this. As the first set of Sri Lankans who are willing to take the ownership of their health history, congratulations and welcome to HealthSync. So we will keep you updated on all the new features that comes out during this beta period. So that is it for the demonstration. Now I will pass to Malshan to continue on the presentation. Thank you.
Yeah, thank you very much, Raidu, for that very detailed explanation and walkthrough on the application. So let's move on to what we expect from you. So this is actually where you, the participants of this meeting, actually come in. So this is where we need your support. So since today is the beta release, so we would like you to go through this application. You will receive all the details, the URL and everything of this application. Uh, I think via email as well as in the chat here. So you will be able to access and experience this application from today onwards, from this moment onwards. So our request to you is please create your HealthSync account today, and please go through this application and play around with almost like all the features that are available right now. And please provide your feedback, whether they are negative or positive. So please provide your honest feedback on the work that we have done, the application that we have created. And so there are mainly two methods that you can give us the feedback. So the first one, or the most recommended one, will be so first you just sign into the application, and on the right hand corner you will see this banner icon, the feedback banner icon. So simply click on it, and after clicking on it you can very simply provide your feedback, whether it's an issue or an idea or any other feedback that you can give. So so that will be the main method that we would recommend. And if not, you can also give us the feedback via email as well, uh, through support@healthsync.lk. So one more thing that I want to mention when providing feedback, let's say that you came through an issue or an improvement point. So please try to be as much as detailed as possible if you have time. So yeah, we would like to request you to be as much detailed as possible. So if you can include these main 3 points in your feedback. First thing, what you were trying to do. The second thing is what happened, or what was the issue that you came across. And the third one, what you expect, or how you would have liked it to go through, or what you expected to happen. If you have time, please share such a detailed feedback. If you have time, it will be really beneficial for us. And one more point that I want to note. So since this is a beta version, this is only available for laptop or desktop use. It is not yet mobile compatible. So we hope to make this application mobile compatible by our release, which is not very uh, far in time domain. I think that the release date will be communicated to you by Damien in the future slides. So for now, please use this application in your laptop or desktop, and please provide your valuable feedback to us. Yeah, that's what I wanted to mention. Over to you, Damien. Thank you.
Thank you, Malshan. Okay, so now let's look into one of the very important section of this whole presentation. This is how we protect your data. And as we all know, health data is highly sensitive, and security is not just a feature for us, it's the foundation of this entire application. And this application is designed to meet three main data privacy compliances: PDPA, Personal Data Protection Act, which is a Sri Lankan privacy compliance, and HIPAA, Health Insurance Portability and Accountability Act, which is the US Act, and a GDPR, General Data Protection Act of the European Union. So we are currently in the process of undergoing some independent audits for this application. Until these audits are completed, these compliance-related requirements are still being finalized and are not included in this version. And I also wanted to highlight that all your data, everything that you add to your HealthSync account is stored in the cloud using industry standard encryption. And to demonstrate on our vision, I'll hand it over to our founding member, Felix Ponvira. And of course, if you have any questions regarding the privacy, you can ask during our Q&A session.
Thank you, Damien. Good evening to everyone. I think all of you have seen now the demo given by Ravidu, our co-founder, about the technical aspect of the HealthSync. So we talk about this subject now about the patient only. Patient means in fact with this demo as well as the privacy policy that Damien has mentioned. So it is the ownership it is purely yours. Really speaking, that you may ask this question. Even the service provider, that HealthSync, even cannot see the data available in the system. That is just I added you. Now this HealthSync is not going to stay along with the patient's requirement, but it's a matter of like a circle, because the patient is always have a direct relationship with the physicians or surgeons, that mean doctors in our case, and also these both parties are depend on that the different type of service providers. Now, first part is of the health cases. Now, our next level is to implement a platform to doctors to see your visibility. I mean, through this to the application to see your data, as long as the patient has given the authority or access approval to the doctor through the system. So both of them can easily exchange for their data to each other to have that. So according to that, this our HealthSync version is not only for patient, but it's a patient-centric digital healthcare ecosystem in Sri Lanka. So having said that, the doctors will have some benefits from that. So they can have a better clinical decisions. They can, because everyone know our physicians are working with the time factor, so they can have a time efficiency, and they are aware of this. Their secure documentation are coming to their hand, and they can continue for their care with the professional collaboration, etc., etc. So at next level, that doctors will have the opportunity to access your data freely through the system. So beyond that, then of course we go to our third place to interact with the service provided. It is service provided because these patients and doctors are all related with the hospitals, the laboratories, because your test reports are coming from the laboratory. And once your report comes, once you met the doctors, then you need to have, you will have a prescription, and then you have to go to pharmacy, then also pharmacy, then some diagnosis centers, because not only the testing, but there are some diagnosis centers are there, then the doctor may have to refer from their hospital to different places. Then of course, at last, of course, widely used for that insurance providers. So likewise, so that third phase, of course, we are going to link with this service, that provider portal, whoever agreed with our, whoever signed with the memorandum of understanding with HealthSync, then of course, and also with the it is important for we have to cater to the patients or our customers. So we will have that part, but it's not for the government hospital. But at this moment, but we are trying to have our best to get the service providers from the private sector. So at the end, you can see this. It is not only a platform for that saving your data or your health document in a platform, but it is like a circle. It will go around and it will be available to everyone at any time in your later stage in your mobile or in your lap. So then, of course, it is easy to manage and it is eco-friendly. That means no documentation and all are in one place. So I hope that our next phases are clearly defined to have some understanding. So then you can see that with this, when we have approach for this digital environment, it is real-time inflow. It is no documentation. All the data, it is encrypted. It is permitted basis, but the service provider cannot see it. And also, patient control data, as Ravindu say, and the communication part of this is well defined and reduce duplication or like mentioned. So there are so many plus points. The patients remain in the center and he is always controlled for their hand. So this is the one. Then long-term vision, it is very clear. Of course, we cannot touch with the national that digital system or healthcare system, but we will become like a role model. I mean, though they have their own part, but we can visibly see that it's that our platforms are going to cater for the customer benefit and customer care and including the trusted way. So accordingly, that you can see that HealthSync empowers the patient, DocSync empowers the doctor. The provider portal empowers the healthcare system. So it is a circle. There's no beginning. There's no end. Hopefully that everyone will get the benefit within same platform. Thank you very much. Over to you, Damien.
Thanks, Felix. Okay, so let's now look at if you experience any issues or if you need assistance during this beta testing period, you can reach out to us at support@healthsync-lk. We will try our best to reply quickly as possible. And what's next? Okay, so if you're on a computer right now, we would like to invite you to take a minute to sign up for HealthSync. It will only take 2 to 3 minutes to sign up. And at the same time, we would now like to open the floor for questions. Please feel free to ask anything, whether it's about the platform, it's about our vision, about the privacy and security, or about the roadmap, anything. The floor is open.
Thanks for the great demo from the entire team. My name is Sachit. I want to ask when would it be available for the general public? When would you releasing the main application?
Okay, I'll take that question. Thanks, Sachit, for raising that. So we have planned to release the full version to the general public on May 2nd. And this event has been planned and we are still working towards that. And yeah, so on May 2nd, the full version will be released to the general public.
Hi, I'm Sachita. First of all, thank you for the great demo and congratulations on the release. Actually, I just want a small clarification regarding the pricing of this application. Is this application completely free or does it have any paid subscription options?
Yeah, I can take that question. So
Yes.
all the core features that Ramindu showed us tonight will be free of charge, and we will keep those core features free of charge. But our goal here is all Sri Lankans start using a platform and start organizing their health records and take the ownership of their health. So from the very beginning, that goal was very clear, and because of that, we are keeping all the core features free of charge. Thanks, Sachin, for that. Yeah, questions.
Thank you, Dean.
Hey, I'm Bimali. Hope you guys can hear me.
Yes, we can. Hi, Bimali.
Yes. Yeah. Thank you for the great demo. And I have two questions actually. First one, when you're giving a signature in the sign up process, and also then there are like another step that you have to upload your NIC. What would be the process of like verifying those signature and also the NIC or the passport?
Okay. Yeah. So the signature that you provide is for your own consent of service. So you have to go through that document. It explains what we give you as a service. So you sign manually after you go through that the consent of service document. So it's for your reference, and it will be used as a legal document that you have agreed to use the services of HealthSync. And we are just the service provider as a SaaS platform. And then you would have to go through all the items in the consent of service, and then your signature is for that. So the second question regarding uploading NIC or identification documents. So this is later on in our releases, we are planning to integrate with healthcare providers, pharmacies, and so on. And then, as you know, to buy medicine from a pharmacy, you need to be at least 18 plus years old. And in the future, if there's a requirement for verification purposes, your identification document will be used for that. And that's the main reason why we request you to add the NIC or the passport. And we want everybody to have just one account, not multiple accounts. That will really complicate the care process in the future when we integrate this with other healthcare providers, especially with doctors. So the identification will be used as that verified, and then during the sign up process, of course, you can skip that. You don't need to upload the ID or the passport during the sign up process. You can add it later. There's no requirement, but it's better to have that on the file. I hope I answered your question, Malik.
Yeah, I would suggest that it's better to have reviewed it maybe like after sign up, like even during like a 2-week or a 1-month period, and to verify whether the uploaded document is a valid passport, whether it is like whether you guys can view it properly, whether the uploaded document is clear enough to keep it as a record for the future purposes. That would be my suggestion. And yeah, it's better to be reviewed from the admin side, like once they have uploaded it, and to be reminded it after like 2 weeks or 1-month period. So the users would upload the NIC just in case. Yeah.
Yeah, thanks so much, Vivaldi, for the valuable feedback. We will definitely take that under consideration for sure.
Damien? Yeah.
Hi. So I have one question. So so since we are managing our health records in this our profile, I saw that like there is another option for healthcare providers as well. So will there be option that the healthcare providers can request the current users information from their application or something?
Yes, there will be a feature for that. That would be the short answer. But the long answer would be, let's say you are a doctor, and then you are with the patient right now, and then if you want to access that patient's HealthSync account to have access to that patient's documents within the HealthSync account, that patient needs to give you obviously the consent to access, and we are still finalizing the details of how the access, the consent would work. We could do an OTP sent to the patient to approve or give it to the doctor, things like that. But definitely, yes, the doctor will have access. The doctor can access patients' health records.
And one more thing that I hope you guys can hear me properly now.
Yep.
Sorry for the issue. So to add one more thing to this, on top of this, we have a full audit capability. So you will always be able to see who accessed your records. So even if a doctor opened your blood report, you will be able to see it on your audit log. So you will get notified. So this specific doctor opened your this specific record. So likewise. So you will, on top of the consent, you will always have the auditing capability of who accessed and who added information to your account. So I hope we answered your question.
May I add Ashan's answer to Ashan's question? Ashan, thank you very much for your question. It is very valuable and valid question. And since we have not moved to this level, of course, now someone can ask if the patient is in the in ICU unit, then how can he receive OTP and give a consent? So when we move to that platform, of course, then of course we had to add one feature that is the secondary mobile number. Secondary mobile number. That means he or she has to appoint a family member to get his her SMS at a similar time, like an emergency, because otherwise he or she may be not in a position to open the account for his account. So that advanced feature, definitely it is in the pipeline. So at that time, because the patients are the main pillars and main customers, so their data are well secured unless his or her permission, no his appointee's permission, no way that this information to used by a doctor or other healthcare providers. That's the way that it's going to work. I hope now it's very clear.
Yeah, okay, cool. Thank you.
Thank you, HealthSync team, to bring up this discussion right at the moment because it's much needed topic in Sri Lanka right now. So my main concern is like, what's your exact revenue model? It's like I see different entities involved in your application, like doctors, pharmacies, and private hospitals like that. But I'm exactly not sure who is your exact customer is, because you mentioned like you're giving these facilities for free. And in addition to that, I just wanted to know, you are expecting for a investment, or do you partners? Do you have a partnership with government or any other organizations or something like that? Yeah, that's my main question is.
Thanks, Sachit, for bringing that up. Like I mentioned, the core features will be free for use, but we are planning to go for a freemium model in the future. So when we add more advanced features, for instance, in the future, we have plans to, you will be able to connect your HealthSync account with your wearable devices such as smartwatches and everything. And then you can get data from other systems. And then if you can use this platform for preventive health, pretty much to see what your health, where you're going, and then we can later on add biomarker analysis into this as well. So when we implement more and more advanced features in the future, we are planning to go for a subscription model. But right now, all the core features will be free of charge to use for adoption purposes. Especially in a country like Sri Lanka, we want everybody to have that option where without the financial burden of, at least to start, keeping everything in one secure place. That's the main reason why I wanted to do it as a freemium model. And to answer your other question, Sachitra, we are a registered private limited company as of now. We don't have any partnership with the government yet, but the government is doing a great job right now. The Ministry of Health has so many initiatives. They're doing really well with promoting digital health in Sri Lanka. So in the future, if there's a need for us to integrate with that, with their national EMR system, we could easily do that because we do follow the FHIR, like international interoperability standards. We can connect with any healthcare system in the world pretty much very easily. So as of now, we don't have any partnership with any organizations. Ramil, would you like to add anything to that?
Not that much. Yes, very interesting and good question that you asked. So as Devin said, we are able to integrate with pretty much everyone. So this is actually one of the requirements of creating this type of centralized patient-centric health record modules. So we need to, by law, create this to be able to integratable with any, integratable with the government main EMR platform. So we are aligned with that, and also we are not trying to be specifically catered to any type of a healthcare organization. That's our underlying vision actually. So we are trying to be centralized. So whether you go to take a medical test in any hospital like Hemas or Asiri or whatever, we want all your health records to be synced into one place. So any doctor can easily, and not only the doctor, you also can easily see your entire health history. So this is the idea behind it, but we are planning some sort of partnerships with all the medical institutions or organizations, but not as of yet, because we are currently focusing on fully implementing this patient-centric module. So I hope we both answered your question.
Yeah, that's a really good answer. And I would like to suggest that because you are collecting a lot of patients and general public into one platform, then you can. So my actual suggestion is to think about the revenue model right at the moment. And because, like I mentioned, you are collecting a lot of people into one platform, then you can market this platform to pharmacies or labs and things like that to maybe run ads or something. Because I have some experience starting these startups failed this just because of this revenue model. Because that's what I really want you to keep this up with, because this is really great idea. This is much needed idea for Sri Lanka right now. So I want you to think about that revenue model as right at the moment. Don't wait until subscriptions comes, or otherwise you have to find some investment or partnerships with some other companies. That's my comment. Thank you.
Thank you very much.
Thanks a lot.
Yeah, Damien, can you hear me, Damien?
Yes.
Okay, I was struggling with my speaker. Right, I have two questions, right? And the first one actually is now, did you mention about the calendar function? For example, if I make an appointment to a doctor, right, I can diarize it, and then probably I can go through the system and see when are my appointment days and what time, etc. Is there any place to capture the information?
Yes, we have that as a separate module to capture all the appointments. is still under development, and then we can integrate with any other service providers as well in the future. So then on the calendar, like you mentioned, you can see everything if you add and all your appointments.
Okay, so in this version, it's not available, right? So it'll be a later version, I guess. Yeah.
Yes. Yes.
Okay. My second question actually is about the GDPR. You're talking about GDPR, right? And now, generally in any GDPR policy, we say, right, how many days or how many years you can retain the data on the system, right? So what is the plan, or what is the, I think, Sri Lanka model to how many years you can keep the data? At the same time, if a patient is dead, and how we are going to merge or purge this information from the system?
Yep. So that the patient is dead, things should come from a doctor. Obviously, when we set up, when we connect to HealthSync, as a registered doctor, as a LMC registered doctor would be a valid person to mark a patient as deceased. And in terms of the purging, we are strictly following GDPR, and then we won't. You can ask for a delete of your account, and then we will remove everything, and you can ask for a download of your entire health data set that we collect. That's all in there. It's all being built as of now. And then the purging process also, we will follow the exact rules within GDPR. Would you like to answer that question further?
No, David, I think you pretty much covered everything. Thanks for the question, Alex. That was
and also I think that in the previous conversation, I think somebody mentioned that you are a collector of information, and then you could share with labs, etc., right? I don't think it's a possible thing, because under GDPR you can't share any data, right?
It is. I mean, it's all up to the patient, and it's purely based on patient's consent. And then we are still in the process of building that very complex patient consent. It's a multimodal process where, like Felix mentioned previously, as a doctor, as a registered doctor, in an emergency care unit, that doctor should be able to quickly access that patient's information. So it's a separate level of consent or separate level of access that these individuals would need. And so the connection part with other with HealthSync and other healthcare providers haven't been fully finalized yet as of now, but we are fully aligning with all the rules and regulations out there.
So I believe that you'll have some flag while registering, right, to get the consent in case if you want to share these details with others, something like that. I'm sure you should have some flag, right?
Yes.
Right? Yeah. And other thing actually now, when you're registering, right, we should have the ID number or the passport number, right? For example, for an individual person who doesn't have mother or father or family, is living alone, but is about below the age of 16, and which doesn't have a passport or ID number, and how is he going to register?
Yeah, it's gonna follow. We are gonna follow the pretty much the same method that all other global EMR systems follow. As a mother can create a child account. So that account below 16 or 18, based on the rules and regulations of that country, that account specific account will be attached to the mother primarily, but anybody else a guardian can have a separate account, linked account as well for a child. And then when the child reaches 16 years or 18 years, both will get notifications saying that it could separate. And then there's a manual process after that, so that child needs to reach out to us, or the mother needs to reach out to us, and our admins will facilitate that separation. And then later on, if they want, they can add each other as family members as well. It's pretty much the same thing, but for a underage, below 16 or 18, it's a linked account.
But okay, you're talking about only no mother, no father, but he's under 16 and he has to go through a custodian. He can't do anything on his own.
Yes.
So in that case, the person who's willing to take that kid or the child over would need to create that link account. And then obviously we will ask for during the verification process, and they would need to submit the documentation for that. But right now it's pretty much the same process like a mother adding a child under her profile. Ramdu, I think you can explain it further if I'm not.
Yes, in this exception cases, it will be sort of a manual integrated process as well. So it will not be as smooth as the mother adding the child, but it will have some sort of a manual intervention where our admins have to validate those documentations, whether this is the legal guardian of this specific child. And we will be able to add, like, create pretty much the same link to the child of the guardian of that person. So that is our model basically.
Now, because I'm thinking about a person who's in a care home or some orphanage, right? And then that means if the guardian doesn't have any record in the system, right, he cannot be added, although he has some medical conditions. So guardian has to be, is a must.
Yes. So since this is a SaaS platform, like they want if they want to add themselves to the system, the child obviously cannot add themselves to the system because they cannot fully operate their account. So if the guardian themselves want to add some child under their care, we can consider some path of validation and making that happen. But as of now, to be honest, we have not thought about that specific process, but we have somewhat finalized the parent adding the child process and the guardian doing the pretty much the same thing. So any other exception cases, we have not yet finalized, but we can come up with some sort of a manual process to do those type of things if it would be required as a feature.
Have you taken some views from the doctors, for example, say the people who are practicing in the private sector, right? When a patient come into their room for any medical stuff, and then if we approach the doctor, okay, doctor, can you log on to computer and are you able to computer or phone or whatever, right? Do you think they will cooperate with you guys, or you have to educate them, something like that?
Yep, we have actually been working with lots of doctors, and the design itself of the HealthSync, we haven't finalized it because we need more inputs from doctors. And we have been talking to lots of doctors, and the adoption piece is definitely there, like you mentioned. And we are trying to bring in AI capabilities into the picture. So where we all know that like doctors are very busy, they don't have time to type in even diagnosis and everything into a patient account. So that's where we could use the AI capabilities of ambient listening, where when the doctor and the patient, the AI feature will listen in and then create all the notes for the doctor to approve, or doctor will have to at the end of the day approve or reject all the notes and everything that the AI model captures. But we are looking into those advanced techniques as well to reduce that adoption gap with doctors when we implement HealthSync.
I think even that part is very important. AI assistant, Yep. Now the technology is there, right? So if you guys can include that in the next phase, at least the AI assistant, right? Doctors may like it because they don't want to keep on typing, And then I think it's a good feature if you can add it. Yeah.
Yep. Thanks so much.
That's all from me.
Thank you very much. Thanks.
Thank you.
Okay, so looking at the time here.
A little bit over time.
Yes, that's the end of it actually. So before we conclude the session, I would like to thank each and every one of you, one of you who contributed us, supported us on this journey. And I'm not going to mention names today because I'm going to forget, and then it's not nice. But as a team, we are very grateful to everybody who contributed, and we need your support in the future as well. And thanks to all of you who joined today to see HealthSync Beta launch. And thank you very much. Please use the system. Give your honest opinion, good and bad, anything. We really appreciate it. And then your participation will help us build a better, secure, and a reliable health platform for Sri Lanka. And I just want to say this is just the beginning. And thank you very much and have a good night.
Thank you.
Thank
Good
you.
night.
Thank you very much, everyone, for joining.
HealthSync, connected care anytime, anywhere.